Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is addressing and understanding mental health challenges for faculty and staff, and it is presented by Nagar Shakarabi. Now let me tell you about today's presenter. Dr. Nagar Shakarabi is a licensed clinical psychologist with a Master's of Arts and a Doctorate of Psychology from Pepperdine University. She has over 15 years of experience working in higher education with students, faculty, and staff. From 2012 to 2016, she also served as the California Mental Health Services Authority Grant Coordinator for University of California, Irvine. Dr. Shakarabi is the inaugural coordinator for the Office of Faculty and Staff Support Services at University of California, Irvine, providing oversight and coordination of faculty and staff mental health resources and programs since 2016.
Thank you for joining us today as we talk about understanding, addressing, and mitigating challenges around faculty and staff mental health. My hope is that we can touch on some important and timely information together that will be helpful whether you're working directly with faculty and staff in the provision of mental health services, or if you're new to this topic and hoping to get the lay of the land. The conversation about student mental health in academia is a familiar one, and now at many institutions across the country, conversations are being had about the state of mental health for faculty and staff. How are faculty and staff doing? How has the pandemic impacted the well-being of our faculty and staff? How does the rising mental health needs of our students impact our faculty and staff? Our learning objectives for today are to explore and understand the role of faculty in mental health on campus, describe what is and is not mental health allyship, review what other institutions are doing to address faculty and staff mental health, and to identify how leadership can help support their faculty. Work-related pressures start early for academics, and it's during the process of career establishment when they report growing stress levels. Research shows that for someone to get a tenure-track job, successful applicants require a greater number of quality publications now than they did in the past. These heavy workloads and a culture that champions working long hours result in stress-induced poor mental health among academics. It may be expected that by mid-career, the pressure would let up, but less productive mid-career academics can be shamed or labeled as unproductive, with productivity being defined almost exclusively in terms of publications and grants. Maintaining high productivity levels in academia has been shown to be particularly challenging for those with underlying mental health issues. The Healthy Professional Worker Partnership survey revealed gender differences in academia. Women reported significant stress from having to manage work, a disproportionate responsibility for family care, a non-supportive organizational environment, and a feeling of being undervalued. Research also reveals that longer working hours are associated with work-life conflict for women faculty, but not for men. Gender inequity has a significant impact on the mental health of women in higher education and has been exacerbated during the COVID-19 pandemic. I hope that we've been able to explore topics and areas that you're hoping to hear about today. In summary, important to remember is that faculty play an important role in student mental health and that they are increasingly impacted by helping students in distress. They are eager and open for more training and investment in mental health from their institutions. There are many historical and systemic factors that impact faculty mental health and well-being that are now being exacerbated by the pandemic. And many institutions are exploring and implementing trauma-informed principles in the workplace and encouraging the integration of well-being concepts into academia.
I also invite everyone to review our content offerings regularly as we are continually adding new courses and webinars in various areas of research, ethics, compliance, and professional development.